టికెట్ స్టార్టెడ్ అనగానే స్టార్టెడ్.
Okay.
High school, I could copy almost any handwriting.
Hi Andy, this is Dr. P. Ravikiran, General Physician and Diabetologist at Owners Robotics Hospital, Champapet. As a part of corporate social responsibility, where we're educating our viewers, let's discuss how to diagnose diabetes, how to interpret our fasting, post-meal and HbA1c values to get a clear picture of our sugars. Let's get into the details. Diabetes is not diagnosed based on symptoms alone. It requires biochemical tests because based on the value of the sugars present, the medications change. Sometimes some patients may need insulin therapy, some patients may need multiple medications, some may not need medications even though the HbA1c is within the limits. And also at the same time, early diagnosis prevents complications like heart disease, kidney failure, nerve damage and vision loss. So in the practical setups, the most common tests we use are fasting blood glucose, post-prandial blood glucose, HbA1c, which is a fast 3-month sugar average. Apart from these three things, we can even use continuous glucose monitoring technique methods available now called as CGMs, where the continuous sugar values over the past 2 to 3 weeks are the values can be provided within an app, which we can interpret based on his values. So the fasting major 3 blood tests are fasting blood sugars, postprandial blood sugars, and HbA1c. Let's get into detail in each terms. Fasting blood glucose. What it means? Fasting blood glucose measures blood sugar after at least 8 hours of fasting. Always remember the ideal way to give your fasting blood sugars is to at least have a fasting duration of at least 8 to 10 or 8 to 12 hours and not more than that. Whenever you fast more than 12 to 14 hours, the fasting blood sugars falsely come low and we are under interpretation that the sugars are normal. So the ideal time would be 8 to 10 hours of fasting. Also, the prior night we have to consume a light meal, not less, not more, which can affect our sugars, but a light meal somewhere around 300 to 350 kilocalories of food. And give the fasting blood sugars early in the morning. After immediately waking up in the morning, we can give the blood sugars so that we get a correct value. Reflects how your body controls glucose in the absence of food. Why FBS matters? First sign of insulin resistance often appears as mildly high fasting sugars. Whenever a person comes with mildly high fasting sugars, that can be the insulin resistance which can be causing that one. Liver overproduces glucose overnight due to reduced insulin action. Whenever there is insulin in the body, insulin suppresses liver from producing new sugars. But whenever there is insulin resistance and the liver stops responding to insulin, there will be high fasting blood sugars, which indicates early stages of type 2 diabetes. Diagnostic criteria. Fasting, normal less than 100 is normal. Fasting blood sugars between 100 to 125 counts to pre-diabetes, and more than 126 amounts to diabetes. So it can be confirmed on repeat testing unless symptomatic. Postprandial blood glucose, also called as 2 hours OGDT. The ideal method to check 2 hours postprandial blood sugars is start it from the time you take your first bite. If you start eating your lunch at 2 p.m. in the afternoon, the post lunch should be done at 4 p.m. Even if you complete your dinner at lunch at 3 p.m. also, the post lunch sugar should be done at 4 p.m. So the 2 hours should be from the time of first bite. 2 hours after you start the first bite is the time you check your post-lunch blood sugars. Measures blood sugars 2 hours after a meal, after consuming 75 grams of oral glucose. Why PBS is more important? Post-lunch blood sugars rise before fasting sugar rises in most Indians. High post-lunch blood sugars is linked with heart attacks, strokes, nerve damage, and kidney disease. Always remember, ideally, a person's fasting blood glucose would be less than 100 and his post-lunch would be less than 140. What happens is the rise of blood sugars is only 30 to 40 mg per deciliter even after you consume a heavy bout of food. But what happens in diabetic patients is secondary to the lack of first phase insulin secretion by pancreas, the spike would be very high. If you want to know more about the details, we already have multiple webinars, previous webinar done on pancreas and role of insulin in pancreas, where we explained you clearly how the pancreas responds. Whenever there is a rise in postprandial blood glucose, the loss of first phase insulin secretion by pancreas is lost, which causes high blood sugars. The values are normal values are less than 140. Pre-diabetes is 140 to 199 or 199. Diabetes is more than 200. Next test is HbA1c. What it means? HbA1c tells us the average blood sugar over the last 90 days, and it does not require fasting. The disadvantage with fasting and post-lunch blood sugars is they are affected by the quantity and the quality of food that we consume. HbA1c doesn't get affected by the one or two bad or good meals. Even if you have one bad meal where you consume a lot of food, HbA1c doesn't get affected by it. So it does not require fasting. Why HbA1c is crucial? It captures the fluctuations and long-term trends, helps evaluate if treatment is working, and at the same time predicts complications like retinopathy, nephropathy, and neuropathy. When HbA1c is persistently more than 7, the patient has high risk of developing complications. What are the normal values? HbA1c less than 5.7 is normal. 5.7 to 6.4 is pre-diabetes, where the insulin resistance has already started and going out of hand. When the HbA1c becomes more than 6.5, it means the patient is diabetic. 6.5 to 7 is the value where the diabetes is under control and there is no need for medications. But when the HbA1c values goes more than 7, it means that the diabetes is not under control. When should you test? The parameters keep on changing, but now age more than 35 years, it's mandatory to get a HbA1c tested to prevent to identify the disease early and to prevent complications. Any person with a history of overweight or obesity, family history of overweight, obesity, family history of diabetes, women with PCOS, which is a sign of insulin resistance, women with gestational diabetes mellitus in previous pregnancies, sedentary lifestyle, high blood pressure or cholesterol, which form a spectrum of metabolic syndrome, acanthosis nigricans, again a symptom of insulin resistance, and or anyone with these symptoms, excessive thirst, urination, weight loss, fatigue, delayed wound healing. If any of these features are present, it would be advisable to get the person tested for diabetes, which include fasting, post-lunch, and HbA1c. This is one of the most important topic. How many tests are needed to diagnose diabetes? If symptomatic plus random glucose more than 200 mg per deciliter, diagnosis is confirmed. If asymptomatic, at least 2 abnormal values from the same or different tests are required. For example, high fasting twice or high fasting plus high HbA1c or high post-meal plus high HbA1c. We want to confirm the patient is a diabetic before confirming and starting him on medications, which would be a lifetime diagnosis. Key clinical insights for the audience. Many Indians show early post-meal rise even with normal fasting sugars. That is secondary to the loss of first phase insulin secretion by pancreas. Also, Indian population have less beta cell reserve which produces insulin, and that is the first one to get damaged, causing early post-meal rise. HbA1c may be sometimes falsely high or low in anemia, kidney disease, hemoglobinopathies, and pregnancy. That's why whenever the HbA1c doesn't match with glucose ratings, rely on fasting and post-lunch blood sugars. Also, there are many conditions where HbA1c and fasting post-lunch may not be working in tandem. Sometimes when both fasting and post-lunch are high and HbA1c is lower within the normal limits, it indicates that the patient has developed diabetes recently and the HbA1c value didn't get enough time to get raised. So if the patient has normal HbA1c and high fasting and post-lunch, it indicates a recently diagnosed diabetes. Whereas if the patient has normal HbA1c and increased fasting, it includes fatty liver or loss of regulation by the liver. If the patient has post-lunch blood sugars in the higher values, it implies that the pancreas are failing. So each values indicates us some value, some inference, which helps us interpret the patient's condition. Take home message. Fasting blood sugars, post-lunch blood sugars, and HbA1c are the gold standard for diagnosis. Always remember, try to get tested for the 3 parameters to get an exact picture of the diabetes condition. Type 2 diabetes often begins with post-meal spikes, secondary to the pancreatic involvement. HbA1c equals to long-term average, and it implies the monitoring conditions where the HbA1c of less than 6.5 is needed without medications to help the patient reverse his diabetes. Get screened yearly if at any risk, especially in countries like India where testing has become so affordable. We would advise our patients and our normal or general population who are more than 35 to 40 years to get at least routinely screened at least once in a year to identify the diseases early and to take necessary precautions to prevent complications. Early diagnosis prevents major organ damage because diabetes damages every major organ present in the body. It can include brain, heart, kidneys, liver, eyes, everything. Every major organ is involved by diabetes. So early screening and identifying diseases early with the blood tests helps us prevent the further complications and make sure that the diabetes can be reversed in good cases with discipline. So always remember, get tested every yearly to protect yourselves. Thank you.